All right. Hope everyone's doing well today. We'll go ahead and we'll jump right into it. Today, we're going to talk about what you need to know about fatty liver disease. Now, we're not talking about fatty livers caused by alcohol abuse. We're going to be talking about NAFLD, which is a non-alcoholic fatty liver disease, and it's defined as an excess accumulation of fats within your liver that's usually accompanied by elevated or high liver enzymes. And as the name implies, like I said, this condition is present in those who don't consume significant amounts of alcohol. So, alcohol intake is one of the leading causes of a fatty liver, but in non-alcoholic fatty liver disease, the condition tends to occur in those who are overweight, who are obese, have high cholesterol, high triglyceride levels, and people who really take in little to no alcoholic drinks. So, according to the American Liver Foundation, non-alcoholic fatty liver disease affects up to 25% of Americans. Now, fatty liver disease, it often goes without having symptoms, thus making yearly blood evaluation extremely important. Make sure your liver enzymes test, your AST, your ALT, GGT, uric acid. It's been known, fatty liver disease can cause fatigue, jaundice. You can get swelling in your legs and abdominal area. Also mental confusion, just to name a few symptoms. If this condition goes untreated, it's going to lead to further complications. You can have liver swelling, all right, which is also known as non-alcoholic steatohepatitis. Okay, also for short, can be abbreviated NASH. Now, this can contribute and lead to liver failure or even liver cancer. All right, so it's not something that you want to mess around with. Two of the most paramount modes of prevention for this condition include eating a nutrient-dense diet and utilizing a cardiovascular exercise routine. Now, the American Liver Foundation, says that this can often help to prevent this condition's development and potentially reversing the problem in its early stage. The leading causes of non-alcoholic fatty liver disease are diet and lifestyle. Now, fructose, all right, which fructose is also known as fruit sugar, but fructose is the first ingredient that's often blamed for this problem, and the need for its elimination is highly important. So, what happens is when you consume, too much fructose, your liver will take that extra or the excess fructose to create fat, and that process is called lipogenesis. And that accumulation of fat leads to a non-alcoholic fatty liver, okay, or steatosis. Now, this specific sugar can be found in fruit juice, high fructose corn syrup, honey, and even agave syrup. Dr. Robert Lustig, he's out of the University of California. He's a neuroendocrinologist, and he calls fructose a chronic dose-dependent liver toxin. There was research that was published in the Journal of Academy of Nutrition and Dietetics, and Dr. Lustig explained the three similarities between fructose and its fermentation byproduct, which is ethanol. Okay, so the liver's metabolism of fructose is similar to alcohol, as they both serve as substances for converting dietary carbohydrates into fat, thus promoting insulin resistance, abnormal fat levels in the bloodstream, and a fatty liver. So, fructose undergoes a specific reaction with proteins, and that leads to the formation of superoxide free radicals. All right, and that can result in liver inflammation similar to acetaldehyde, and which is an intermediate metabolite of ethanol or alcohol. Now, by stimulating a particular pathway of the brain, both directly and indirectly, fructose creates a habituation impossible to dependence, much like that of alcohol. I often refer to these types of foods as dietary crack because they're high in sugar and they're also highly addictive. I actually think I heard of that term from Dr. Seaman, so I'll definitely give him credit on that. But supplements and also appropriate testing can help this condition. There was a study that tested the hypothesis that low levels of vitamin E may be associated with liver disease, and what they found was that lab mice that were engineered to have inadequate vitamin E levels showed the following. What they found was that those mice had increased oxidative stress, fat deposition, and other signs of liver injury. Now, when this same animal population was supplemented with vitamin E, significant symptom relief was noted. And additional study was done to evaluate the role of specific vitamin E supplementation. And what they found was, and this is very noteworthy, was that lab animals that were given both full spectrum mixed tocotrienols and alpha tocopherol had a vastly significant level of improvement versus the group that was supplemented with only alpha tocopherol or mixed tocotrienols. Now, these benefits, they included a reduction in triglyceride accumulation. They also had a decreased level of lipid peroxides, and they also had an improvement in their liver markers, and there was decreased liver scarring. So, knowing your liver enzyme scores as part of full blood evaluation, can be part of a crucial step, preventing or protecting yourself, from this sometimes silent condition called fatty liver disease. Supplementation with vitamin E and there's other liver support formulas that may be necessary in order to keep the condition at bay, but you really won't know what you need until you get the appropriate testing. So you want to make sure that you get tested first to make sure that you're on, the right supplements, the right nutrition program. And by getting a comprehensive blood panel performed, by an experienced healthcare professional, you want to take that information and then you can make an individualized program that could be compiled for you, based on your findings. All right. And that way you're not going to have to guess on, what you need to eat or what supplements that you should be on. We always want to, take the guesswork out, by getting tested objectively. So yeah, I hope that helps. Hope you guys learned from what we went over today. And I'll look forward to talking to you guys soon. All right, you guys have a great day.